Have you ever wondered what happens to the body and mind of older adults who frequently engage in masturbation? If you're over 50, this topic might resonate deeply with you. In many cultures, discussing sexuality in later life remains a taboo, an uncomfortable subject often silenced by embarrassment or misunderstanding. But today, we are going to break that silence. We'll approach this topic from a scientific, medical, and psychological perspective to uncover the surprising truth about how this intimate practice affects overall well-being. As a sexologist and medical expert in senior health, it's crucial to understand how masturbation influences physical and emotional health, especially for those who practice it regularly. Could it be a key to longevity and mental clarity? Or does it carry hidden risks that few talk about? The reality may shock you. We will dismantle the myths surrounding pleasure in old age and reveal groundbreaking research on how self-stimulation can either enhance or hinder your quality of life. This content is specifically designed for adults, particularly those experiencing the second half of their lives, who want to understand how their bodies and minds are evolving. Masturbation is a natural and universal activity that provides both physical pleasure and emotional relief, regardless of age. However, the way it is experienced changes over time. As we grow older, the body undergoes several natural transformations: hormonal shifts, changes in nerve sensitivity, and alterations in sexual desire. But does this mean that pleasure fades away? Absolutely not. In fact, many studies suggest that maintaining an active sex life, including self-pleasure, can have remarkable health benefits for older adults. One of the key physiological changes in aging is the decline in testosterone and estrogen levels. These hormones play a vital role in regulating libido, sexual function, and overall energy levels. While some people assume that sexual desire disappears with age, research shows that it simply manifests in different ways. For many older adults, masturbation becomes a powerful tool to reconnect with their changing bodies, rediscover pleasure without the pressure of performance, and enhance their overall sense of well-being. When we think about health and wellness, topics like diet, exercise, and sleep often take center stage. But what if there was a completely natural activity that could boost mental clarity, improve heart health, reduce stress, and even enhance immune function? One that many people engage in but rarely discuss openly. That's exactly what regular masturbation does. While often surrounded by myths and cultural taboos, science reveals an astonishing array of benefits linked to this private yet powerful practice. Let's dive into the hidden health benefits of masturbation, backed by research, and uncover why this natural behavior might be one of the simplest ways to enhance both physical and mental well-being. Have you ever noticed a deep sense of relaxation after self-pleasure? That's not just in your head, it's a direct result of powerful chemical shifts in the brain. Research published in the Journal of Sexual Medicine confirms that orgasm leads to the release of dopamine, oxytocin, and endorphins, neurotransmitters known to enhance mood, promote relaxation, and reduce stress. One of the most important effects of masturbation is its ability to lower cortisol, the body's primary stress hormone. Chronically high cortisol levels have been linked to anxiety, depression, high blood pressure, and even weight gain. A study from Neuroscience and Biobehavioral Reviews found that sexual activity, including masturbation, triggers the parasympathetic nervous system, which helps counteract the effects of chronic stress and promotes a calming, restorative state. Sleep disorders, particularly insomnia, affect millions of people worldwide, especially as they age. However, science shows that masturbation may act as a natural sleep aid. A 2019 study in Frontiers in Public Health found that self-pleasure before bed promotes faster sleep onset and better sleep quality due to the surge in prolactin, a hormone associated with relaxation and drowsiness. Moreover, orgasms help regulate melatonin production, the hormone that controls sleep cycles. This is particularly beneficial for individuals suffering from irregular sleep patterns, including those dealing with menopause, shift work, or chronic stress. Rather than relying on pharmaceutical sleep aids, regular masturbation could serve as a safe and effective way to improve rest and recovery. Cardiovascular health is often associated with activities like running or lifting weights. But did you know that masturbation also supports heart function? Studies indicate that sexual activity, including solo sex, enhances blood circulation, which is crucial for overall cardiovascular health. A groundbreaking study published in the American Journal of Cardiology found that men who engaged in sexual activity, including masturbation, 2 or more times per week had a significantly lower risk of heart disease compared to those who were less sexually active. This is because orgasm triggers vasodilation, the widening of blood vessels, which reduces blood pressure and improves overall circulation. Additionally, masturbation stimulates nitric oxide production in the body. Nitric oxide plays a critical role in blood vessel health, reducing the risk of arterial plaque buildup and enhancing oxygen flow to vital organs. This mechanism works similarly to how some medications, like Viagra, improve erectile function by increasing blood flow. Could masturbation actually help fight off illness? Surprisingly, yes. Research published in Psychological Reports found that sexual activity, including self-pleasure, boosts the immune system by increasing levels of immunoglobulin A, IgA, a key antibody that defends against infections like the common cold and flu. Furthermore, a 2004 study from the University of Essen in Germany demonstrated that orgasm temporarily increases white blood cell count, which enhances the body's ability to combat pathogens. These findings suggest that regular masturbation could serve as a simple yet effective way to keep the immune system strong and resilient, particularly during flu season or periods of high stress. For men, regular ejaculation has been linked to a lower risk of prostate cancer. A landmark study conducted by Harvard University followed nearly 30,000 men over several years and found that those who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated less frequently. Scientists believe this protective effect is due to the flushing out of carcinogenic substances from the prostate through ejaculation. The prostate naturally accumulates toxins and inflammatory compounds, and regular clearance through masturbation or sexual activity may prevent harmful buildups that could contribute to cancerous changes. Suffering from migraines or chronic pain. Masturbation might be a natural remedy. Studies show that orgasm triggers the release of endorphins, natural painkillers that work similarly to opioids. Research from Cephalalgia, the Journal of the International Headache Society, found that over 60% of migraine sufferers experienced partial or complete relief from their headaches following sexual activity, including masturbation. Additionally, masturbation has been linked to reduced menstrual cramps in women. A study by Planned Parenthood suggests that self-pleasure increases blood flow to the pelvic region, alleviating discomfort and promoting muscle relaxation. This natural pain relief mechanism provides a safe, drug-free alternative for individuals dealing with chronic pain conditions. Hormonal fluctuations can impact everything from mood and energy levels to libido and metabolism. For both men and women, masturbation helps regulate critical hormones like testosterone, estrogen, and oxytocin, ensuring better overall balance. Sexuality is an essential aspect of self-image, and maintaining a positive relationship with one's body is crucial for mental well-being. Studies show that individuals who engage in regular masturbation report higher self-esteem, greater body confidence, and reduced feelings of shame or self-criticism. According to research from the Archives of Sexual Behavior, people who feel comfortable exploring their own bodies through self-pleasure tend to have healthier relationships, better sexual communication, and a more positive outlook on intimacy. This is particularly important as people age, helping to reinforce a sense of control and agency over their own bodies. For many older adults, aging comes with a sense of losing control over their bodies. Wrinkles appear, muscle mass declines, and overall energy levels shift. However, masturbation serves as a form of self-care and body appreciation. It reinforces a positive self-image and helps individuals feel more in tune with their own physicality. Psychologists argue that maintaining a connection with one's sexuality can improve self-esteem and reduce feelings of loneliness, which are common in later years. But what happens when masturbation becomes excessive? While moderate self-pleasure has undeniable benefits, compulsive behavior can lead to unintended consequences. Overstimulation of genital nerves can result in temporary desensitization, meaning that more intense stimulation is required to achieve the same level of pleasure. This can create a cycle of frustration and even anxiety, particularly in those who rely on masturbation as their primary source of emotional comfort. Socially, Excessive self-pleasure might lead to increased isolation. Many seniors experience dwindling social interactions due to retirement, loss of loved ones, or mobility challenges. If masturbation becomes a substitute for meaningful relationships and emotional support, it can contribute to deeper feelings of loneliness and detachment from the outside world. For decades, masturbation has been surrounded by cultural taboos, myths, and misinformation. Some believe it weakens the body, drains energy, or leads to compulsive behavior, while others see it as a natural and healthy aspect of human sexuality. But what does science actually say? Medical research has uncovered fascinating insights into how self-pleasure affects the brain, body, hormones, and long-term health. From reducing disease risks to enhancing mental well-being, let's explore what clinical studies reveal about the effects of masturbation. One of the biggest misconceptions about masturbation, particularly among men, is that frequent ejaculation lowers testosterone levels. This belief has led some to practice abstinence in hopes of boosting muscle growth, aggression, and libido. However, research paints a different picture. A study published in the Journal of Clinical Endocrinology and Metabolism found that while testosterone levels may experience a brief dip immediately after ejaculation, they quickly return to normal. In fact, another study in hormones and behavior demonstrated that short-term abstinence, 3 to 7 days, could lead to a temporary spike in testosterone, but prolonged abstinence had no long-term benefits. The body naturally regulates testosterone levels, meaning masturbation does not cause a significant or permanent reduction. In contrast, completely avoiding ejaculation for extended periods could lead to increased stress and irritability due to the buildup of sexual tension. So, rather than harming testosterone production, masturbation appears to be a natural way for the body to balance hormone levels without negative long-term effects. When people think of heart health, they often focus on diet and exercise. But sexual activity, including masturbation, plays a surprising role in cardiovascular function. A study published in the American Journal of Cardiology found that men who engaged in regular sexual activity had a 50% lower risk of dying from heart disease compared to those who had sex less frequently. But how does this apply to self-pleasure? It turns out that masturbation triggers similar physiological responses as sexual intercourse, including increased heart rate, improved circulation, and the release of nitric oxide, a molecule that relaxes blood vessels and lowers blood pressure. A study in European Urology suggests that regular ejaculation may even reduce the risk of hypertension, a major contributor to heart disease and stroke. For women, masturbation has been linked to better blood flow to the pelvic region, which can help maintain vascular health and prevent sexual dysfunction later in life. The bottom line? Masturbation is more than just a private pleasure. It could be an unexpected ally in heart health. One of the most compelling medical findings on masturbation is its role in prostate health. The prostate gland naturally accumulates fluids that can contain carcinogenic substances. If these fluids are not regularly expelled, they may contribute to inflammation or even cancerous changes over time. A groundbreaking study from Harvard University, published in European Urology, tracked over 30,000 men for nearly 2 decades. The researchers found that those who ejaculated at least 21 times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated less frequently. The protective effect was even stronger in older men, suggesting that maintaining a healthy sexual routine, including masturbation, might be an important factor in long-term prostate health. Scientists believe that frequent ejaculation helps flush out potential cancer-causing agents and reduces the likelihood of prostatic congestion, a condition where fluids accumulate and create inflammation. While masturbation is not a guaranteed way to prevent prostate cancer, medical professionals now widely acknowledge its role in supporting prostate function. The mental health benefits of masturbation are often overlooked, yet they are some of the most well-documented effects in scientific literature. Studies have consistently shown that sexual activity, including self-pleasure, triggers the release of mood-enhancing neurotransmitters such as dopamine, oxytocin, and serotonin. A study in the Journal of Affective Disorders found that sexual activity, including masturbation, was associated with lower levels of stress and anxiety. Researchers believe this is due to the activation of the parasympathetic nervous system, which counteracts the effects of chronic stress by reducing cortisol levels, the hormone responsible for the fight-or-flight response. Oxytocin, often referred to as the love hormone, is released in large quantities during orgasm. It has been shown to promote feelings of relaxation, emotional bonding, and even pain relief. A study in biological psychology found that higher oxytocin levels were correlated with reduced symptoms of depression and anxiety, reinforcing the idea that sexual pleasure can be a natural way to improve mental well-being. For individuals suffering from insomnia, masturbation might also serve as a natural sleep aid. A study published in Frontiers in Public Health found that post-orgasm relaxation is associated with higher levels of prolactin, a hormone that induces drowsiness and aids in deeper sleep cycles. Could masturbation actually help fight off infections? Research suggests that it might. A study from the Journal of Sexual Medicine found that sexual arousal and orgasm temporarily increase levels of immunoglobulin A, IgA, an antibody that plays a key role in defending against pathogens such as bacteria and viruses. Another study from the University of Essen in Germany discovered that orgasm stimulates white blood cell production, which strengthens the body's natural ability to combat illnesses. These findings suggest that regular masturbation may serve as a small but meaningful boost to immune function, especially during times of high stress, when immunity is naturally suppressed. While moderate masturbation is linked to multiple health benefits, excessive indulgence can lead to certain negative effects. Some studies have reported cases where individuals develop compulsive sexual behaviors, often referred to as hypersexual disorder or porn-induced erectile dysfunction. A study in JAMA Psychiatry found that excessive sexual activity, including compulsive masturbation, can rewire dopamine pathways in the brain, leading to reduced sensitivity to pleasure over time. This is particularly relevant in the digital age, where easy access to explicit content may contribute to unrealistic expectations and difficulty achieving satisfaction in real-life relationships. Additionally, overstimulation of the genital nerves may lead to temporary desensitization, requiring more intense stimulation to achieve the same level of pleasure. This phenomenon, often referred to as pleasure tolerance, can contribute to frustration or even anxiety over time. Medical studies are clear. Masturbation, when practiced in moderation, is not only safe but beneficial for both physical and mental health. From reducing stress and improving sleep to supporting heart health and even lowering prostate cancer risk, the evidence overwhelmingly supports self-pleasure as a normal and healthy part of human sexuality. However, like any activity, balance is key. If masturbation begins interfering with daily life, relationships, or emotional well-being, it may be worth reassessing one's habits. The goal is to integrate self-pleasure as part of an overall wellness strategy, just as one would with exercise, nutrition, or meditation. As science continues to shed light on this often misunderstood topic, it's time to move beyond stigma and embrace the facts. Sexual health is an integral part of overall well-being, and masturbation is a completely natural, science-backed way to support a healthier and happier life. If you found this information enlightening, subscribe to our channel for more deep dives into health, science, and wellness topics. Together, let's break down taboos and empower ourselves with knowledge.